The CDC is issuing a new alert about mpox. It's telling doctors to be on the lookout for symptoms and report suspected cases of the more severe strain immediately. It comes as California reports the first U.S. case of the more severe strain in a traveler from Africa. ABC's medical contributor Dr. Alok Patel joins me for the latest on that. Dr. Patel, this risk to the public remains low, but how concerning is it that the CDC is now alerting doctors to be on the lookout for this and that this severe strain, it sounds like, is out there?
Dan, it is important that people understand that the risk is low, but that we realize that infectious disease does not exist in a vacuum. And an outbreak elsewhere could potentially be an outbreak everywhere. In this specific case, somebody returning from Eastern Africa came to California. They had this more severe version, this more severe strain of mpox. The good news is per reports from the CDC, the individual got treatment in a facility and is now at home recovering and in isolation, which is important. But this is a story that could be replicated with whooping cough, measles, influenza, or any disease, which is why it's so important that we pay attention to global health, surveillance, prevention, and we make sure that those resources are up to date everywhere to prevent outbreaks.
So what's the difference between this severe strain and other strains we've seen in recent years?
You know, people, when talking about mpox, will often hear people talking about these groups called clades, clade 1 and 2. Now imagine that these are siblings of the same common ancestor virus, so they have similar genetic material. And to give you a frame of reference, we talked about different clades with COVID, but we use a different term for it. So clade 2 of mpox, which is generally considered to be less severe, is what was responsible for the global outbreak in 2022 and 2023. Now clade 1, which has a higher mortality rate, is what we're currently concerned about right now. And it's important to note that clade 1 may not have as high of a mortality rate in countries with a developed health system, but in the outbreak throughout this year in Africa, clade 1 was affecting younger individuals under the age of 15, causing more severe illness, which is why the World Health Organization has been paying such close attention to these cases.
So how can we best protect ourselves from mpox and some of the others that you listed?
You know, it's important that we pay attention to exposures because mpox can start out like any generic illness with fever, muscle fatigue, and then that telltale rash, which a lot of people are familiar with from pictures, which could start out as flat spots and then progress into nodules or even blisters. But remember, these rashes can look different on different people, especially people with different skin colors. So it's important to know if you're traveling to a high-risk country, which mpox clade 1 used to just be endemic or local to Eastern Africa, but it's now spread to about 20 African countries. There are cases of travel associated in UK, Sweden, Thailand, and now in California. And paying attention to that transition from post-exposure. And if you're high risk or traveling, to get 2 shots of that vaccine, which can prevent severe illness.
All right, ABC's medical contributor, Dr. Alok Patel, thank you.